John here from Anatomy Bootcamp, and welcome back into another video. In this lesson, we're going to be taking a look at the brainstem. We're going to be covering the three major subdivisions of the brainstem, as well as the external features and the internal features of the brainstem, and a little bit of functioning of what they do. So first up, we have a case study. This is an interesting one. We have a 10-year-old child who comes in presenting of persistent headaches in the morning. They're experiencing nausea, vomiting, and fatigue. And recently, they have been reporting abnormal eye movements and delayed auditory reflexes. You order your MRI to confirm your diagnosis, and you get this. So we're going to be going through some of these features of the brainstem, discussing some of their functions, and then hopefully by the end of this, we can understand what is going on. So getting back to the anatomy, the brainstem can be classified into three different areas. We have the midbrain, the pons, and the medulla. So first up, we're going to have our midbrain. And looking at our diagram, this is going to be the most superior aspect of our brainstem. It's going to sit just under this structure. This is actually the diencephalon right at the core of the cerebral cortex out here. So we have our diencephalon right under that. That's where our brainstem starts, and the first portion is going to be the midbrain. Next up, we have our pons. And our pons is going to be this center area right here. And the way I classify it is it has this bulge coming off anteriorly, which is very prominent in some of the other images that we're going to be looking off. You can see it has this bulge right here. Next up, we have our medulla, and that medulla is going to be situated right here. And the medulla actually houses some of the primitive nuclei which are important for our basic survival, such as breathing, heart rate, those sorts of things. So taking a look at the anterior surface of the brainstem, we're going to be labeling a few structures. So first off, let's get ourselves oriented. So this, of course, is an anterior view. We would have our medulla down here, our pons right here, and our midbrain right there. These two structures sitting on top, these are going to be those thalamic bodies, part of the diencephalon. And this X structure, well, that's going to be cranial nerve 2. That's going to be the optic nerve with the optic chiasm and the optic tract. So first up, let's label our cerebral peduncles, which are going to be these structures right here. And these are actually large white matter bundles. These are the projection fibers, which are connecting the higher cortical areas to the lower brainstem and spinal cord areas. So as we'll discuss, these are carrying corticospinal as well as corticobulbar tracts from the higher cortical area to the brainstem and to the spinal cord. Now, between our cerebral peduncles, we have this space in here, and this is going to be our interpeduncular fossa. And within that interpeduncular fossa, that's where we're going to find our infundibulum, pituitary glands, and our mammillary bodies. So our mammillary bodies are going to be these two structures right in here, and these are going to be involved in memory. Our pituitary is this structure right here, and that infundibulum or pituitary stalk, well, that is going to be attaching the pituitary gland to the hypothalamus, and this acts as the bridge connecting the two structures. So these are all the structures found in the midbrain between the diencephalon and the pons. Now we're going to move down and look at some structures found here in the medulla. First up, we're going to have our pyramids and our pyramidal decussations. So these are the two anterior bulges, which are going to be found most medial on the medulla. And these are carrying those corticospinal fibers down from those cerebral peduncles into that pons. And then this is the continuation part. Those corticospinal tracts continue into the pyramids. And that pyramidal decussation, that's going to be a point towards the superior aspect between the two pyramids where the corticospinal fibers cross over. Because if you remember, your right cortex controls the left side of your body and your left cortex controls the right side of the body. So at this point, this is where those fibers cross over. Just lateral to our pyramids, we're going to have our olives, and these are where the olivary nucleus are found. It's going to be these structures on either side. And found between our two pyramids, that's where we're going to have our anterior median fissure right here. And found between the olives in the pyramid, that's where we're going to have our ventral lateral sulcus, right here. So now that we've covered some of the structures and features on the inferior aspect of our brainstem in our medullary region, let's take a look at some of the functions that these structures perform. So like we said, that infundibulum, or that pituitary stalk, is going to be the connection between the hypothalamus and the pituitary gland. And this allows for signals from the hypothalamus to be continued to that posterior pituitary gland. The cerebral peduncles, those are going to be projection fibers where our corticospinal and our corticobulbar motor tracts are passing through. Our mammillary bodies, well, these are going to be involved in memory. Think of mammillary, memory. They go together. Our pyramids, these are going to be the continuation from those cerebral peduncles into that medullary region, and these are going to be carrying those corticospinal and corticobulbar motor tracts as well. And within those pyramids, we have that point of decussation known as pyramidal decussation, and this is crossing over of descending fibers. So as the corticospinal and corticobulbar tracts come down from the cortex, they cross over at this point along the midline between the two pyramids. And then finally, we have our olive, which houses the olivary nucleus, which coordinates signals from the spinal cord to the cerebellum, and this is to regulate motor coordination and learning. So now we flip things around and we're taking a look at the posterior aspect of the brainstem, and we're going to be identifying some of those external or superficial structures. So first up, on the posterior or the dorsal aspect of the midbrain, it's going to be this region right here. So if we orient ourselves, again, these are going to be those thalamic bodies on either side. This is that third ventricle. Here's that pineal gland. So this entire region, that's going to be that diencephalon. Just below that, that's where we're going to find our midbrain. So within the midbrain, on the dorsal aspect, we have these four little bulges coming off. And we also have this little nerve right here. And if you remember from our cranial nerves lecture, which nerve comes off the dorsal aspect of the midbrain? It's the only cranial nerve that comes off the dorsal aspect of the brainstem. It's that trochlear nerve. So this right here, that's that trochlear nerve. And this is a good boundary to indicate where the midbrain ends and where that pons begins. So coming back to these four bulges right here, this is actually called the corpora quadrigemina, and it is made up of the superior colliculi right here and the inferior colliculi right here. So our superior colliculi are going to be these two, and our inferior colliculi will be these two inferiorly. Now moving below that trochlear nerve into that pons region, we're going to take a look at some cerebellar peduncles. And the cerebellar peduncles are what are connecting the brainstem to the cerebellum. So the cerebellum has been removed in this case. It would have been sitting right here. So first up, we have the superior cerebellar peduncles, which are connecting the midbrain to the cerebellum. We have the middle cerebellar peduncles, which are connecting the pons to the cerebellum. And then we have the inferior cerebellar peduncles, which are connecting the medulla to that cerebellum. And because that cerebellar cortex has been removed, this exposes this region right in here, which is the fourth ventricle. So here is that third ventricle, and then down here is that fourth ventricle, and they're connected by a tiny tunnel known as the cerebral aqueduct. So here's that fourth ventricle, and this fourth ventricle is only seen if we cut through these cerebellar peduncles and remove that cerebellar cortex. So now we're going to be moving a little bit more inferiorly. First, within this fourth ventricle region, once we take that cerebellar cortex off, you'll see these two bulges right in the middle of that fourth ventricle. These are known as the facial colliculi. And these facial colliculi are actually created by the facial nucleus and the fibers coming off of the facial nucleus wrapping around the abducens nerve and creating this prominent bulge on either side. And as we move lower or into the medullary region, we're going to have these two bundles of white matter coming up the posterior aspect of the medulla. The lateral one is going to be the fasciculus cuneatus, and the medial bundle is going to be the fasciculus gracilis. And the way I remember it is from lateral to medial, we have CG, or cool guy. So these cool guys are going to be found on that posterior aspect, and they're white matter bundles from that dorsal column medial lemniscal pathway coming up the posterior aspect of the medulla, and they synapse in these bulges right here. So these are regions known as the gracile tubercle, here in orange, which is the continuation of that fasciculus gracilis, and the cunate tubercle, which is the continuation of that fasciculus cuneatus. And deep to these tubercles, we have the nucleus gracilis and the nucleus cuneatus. Now, coming over to this side, found in the midline posteriorly between our two fasciculus gracilis, right here and right here, we're going to have this posterior median sulcus. And if you think about it and break down the name, posterior, it's going to be posterior, median, it's along the midline, and it's a sulcus. And since we have a posterior median sulcus, we're going to have a posterior lateral sulcus, which is going to be the most lateral sulcus on the posterior side. And then found between the posterior lateral and the posterior median sulcus, we're going to have this sulcus known as the posterior intermediate sulcus. So now that we've identified all these structures, let's discuss some of their functions. So like we said, up here and here, we're going to have the superior and the inferior colliculi. So the superior colliculus, well, this has a role to play in the visual reflex pathway, as well as eye movements. Our inferior colliculus, well, this is involved in the auditory reflex pathway. So if you think your eyes are above your ears, eyes above ears, superior colliculus, inferior colliculus. And then like we covered, the superior cerebellar peduncle, well, this connects the midbrain to the cerebellum. That middle cerebellar peduncle connects the pons to the cerebellum, and that inferior cerebellar peduncle connects the medulla to the cerebellum. Our facial colliculus, well, that's going to be superficial to those facial nucleus fibers. Our fasciculus gracila, that DCML, dorsal column medial lemniscal sensory pathway, except it's for the lower limbs. So this fasciculus gracilis, the medial one, that extends all the way down to the legs. And our fasciculus cuneatus, similar DCML pathway, except this one does upper arms. So think about, because the fibers from your legs need to travel all the way up to your head, they're going to be most medially because they start the fibrous pathway, whereas the fibers coming from your arms, well, those are going to join it and eventually once you get past this point. So think about the arms are going to be lateral, the legs, well, those are going to be medial. And then, of course, we have our gracile tubercle, which houses the nucleus gracilis, and our cunate tubercle, which houses that nucleus cuneatus. So now we're going to shift our focus inwards and take a look at some of the internal structures and areas of the brainstem. So first up, two important areas are going to be the tectum and the tegmentum. Now that tectum, that's going to be making up the posterior aspect of the midbrain, and that's going to be found in that corpora quadrigemina area where we have the superior and the inferior colliculus. So it's basically just the superior and inferior colliculus which make up this tectal region. And if you remember, these are involved in visual pathways and reflexes, and these are involved in auditory pathways and reflexes. Next up, we have this tegmental area right here. So this is where we're going to have our reticular formation, our cranial nerve nuclei, which give off the cranial nerves which go to the head and neck, as well as ascending sensory pathways, which are going to be passing through here. There's a lot going on in this area, and sometimes students confuse the tegmentum for the tectum. Remember, the tectum is just this small area back here, and the word tectum is also pretty small. Tegmentum is this larger area in here with a lot going on, and if you look at the word tegmentum, it's larger than tectum. That's just how I remember it. It's just a quick and easy little trick, nothing too complicated. And then found between the tectum and the tegmentum, we have this little channel, and this channel is found between the third ventricle up here and the fourth ventricle down here. And this channel is known as the cerebral aqueduct. And the cerebral aqueduct is going to allow cerebral spinal fluid, or CSF, that is produced in the lateral ventricles, which is transported into the third ventricle, to then be transported down into the fourth ventricle and bathe the outer CNS area. So enter that subarachnoid space and fill that space with cerebral spinal fluid. So as you'll see when we get to the chapter on the ventricles, this passageway is actually extremely important and can cause a lot of problems if it is blocked. So now let's take a closer look at the fiber pathways passing through the brainstem, as well as look into that tegmental area and break down some of the structures. So found within that tegmental area, we're going to have the ascending fibers. And these ascending fibers, well, these are going to be your anterior and lateral spinothalamic tracts, your dorsal column medial lemniscal tracts, as well as your spinocerebellar tracts. And these are involved in conscious and unconscious perception of our surrounding environments. So it's going to be communicating information gathered from our bodies up to our cortical area. And as it does so, it passes through this tegmental area back here. And while we're in that tegmental area, we'll highlight the reticular formation next, actually. And this particular formation is going to be like a network of nuclei flooding this tegmental area between the cranial nerves. And what this is responsible for is our very primitive functions. So these are things like heart rate, breathing, pain modulation, sleep. These are functions that are found in living mammals millions and billions of years old, before our neocortex was fully formed and could have more involvement with some of these functions. We needed this reticular formation to carry out these functions without actually thinking about it. And then finally, going back, we have our descending tracts. Now these are going to be motor pathways, specifically that corticospinal and that corticobulbar tract. And these are carrying information, motor information from that primary motor cortex down to the face and the body. And it's going to pass through this area right here. And if you remember, this is going to be that cerebral peduncle. It's going to go behind this bulge of the pons, and it's going to continue down the pyramids of the medulla, at which point it crosses over. So it crosses over to the opposite side, or that contralateral side. So now, coming back to our patient from the beginning who is experiencing headaches in the morning, nausea, vomiting, fatigue, as well as delayed auditory reflexes and abnormal eye movements. If you look at our MRI, you can see, so let's orient ourselves first. So right here, that's that corpus callosum. All this area, this is that neocortex. Here we have the cerebellum. Right here, this is that brainstem. This bulge right here, prominent bulge, always look for this just to orient yourself. So here, that's the pons area. Above the pons, that's where we're going to have the midbrain. Below the pons, that's where we're going to have the medulla. Let's look at our midbrain. So here, that would be cerebral peduncle. If we move back, can we identify the inferior and the superior colliculi? Well, I see a little bit of an inferior colliculus right there. And then right here, we have this massive tumor, or what is known as a grade 1 tectal plate glioma. So this is occurring in that tectum of the brainstem, and it's interfering with the superior colliculi involved in eye movements, as well as that inferior colliculus involved in auditory reflexes. And if you remember, just anterior to that tectal area, we have that cerebral aqueduct, which is shunting cerebral spinal fluid from our third ventricle into our fourth ventricle. And this tumor is so large that it's blocking, or it's interfering with that passageway. So you can see this dark structure right here, that's that third ventricle. And if you notice, it's quite enlarged because we're having a backup of cerebral spinal fluid not being able to pass through to our fourth ventricle down here. And so what this is doing is expanding this third ventricle, expanding our lateral ventricles, and then it's pushing the cortex against the cranium, which is causing these other symptoms, such as headaches in the morning, nausea, vomiting, fatigue, this is because of that increase in the intracranial pressure. So again, grade 1 just means that it's benign, and tectal means that it's in that tectal region, or that tectum region, and it's a glioma, so it's a brain tumor. So now let's move on to a couple of bell ringer style practice questions. First up, we have identify structure A, which is right here, as well as what two structures is B connecting. So if you want, you can pause it and answer this question for yourself. I'm just going to get right into it. So structure A, let's orient ourselves first. Right here, well, if this label wasn't here, we would know this is the pontomedullary junction. If you remember, we actually have two nerves coming out right here, which are the abducens nerves. So this is that pontomedullary junction. These structures right here, which are like two columns holding up the brain, these are going to be those cerebral peduncles. So this structure right here in the middle, this bulging out structure, this must be our pons. And coming off of the pons posteriorly, we're going to have this structure right here, which is going to be that middle cerebellar peduncle, which is connecting the pons to the cerebellum. So again, structure A, that's the pons. Structure B, this is the middle cerebellar peduncle, and structure B is connecting the pons and the cerebellum. So now let's go into question 2. So for our second practice problem, we have identify what function structure A is involved in and what type of information is being carried through structure B. So structure A, it's going to be these two bulges right here. Structure B, it's going to be these two bulges on the anterior surface of the medulla. If you want, you can pause and answer them. I'm just going to jump right into it. So these structures right here, found between our two columns, or our cerebral peduncles, within this interpeduncular fossa, well, these are going to be those mammillary bodies. Here is that X from our cranial nerve 2. We have our optic nerve, optic chiasm, optic tract. Just posterior, coming off here, we would have the pituitary stalk, or the infundibulum. And then posterior to that, we have those mammillary bodies. And if you remember, mammillary, memory, mem. So whenever you think of mammillary bodies, think of memory, because that's what they're involved in. So our mammillary bodies are involved in memory. And then coming down here, if you remember, we're going to have fibers which are coming from the cortex down on either side, and these are projection fibers, and then they cross over around here. So this is all motor information, because these are descending fibers coming down these cerebral peduncles and then passing through this pyramid area and then crossing over at that pyramidal decussation. So what is the function of structure A? Well, this is going to be memory, mam equals mem. So mammillary equals memory. And then what information is being carried through structure B? Well, this is the pyramid, so this is going to be motor information. And these are going to be part of those descending pathways. So that is it for today's lesson. To wrap things up, we covered how to identify the external anatomy of the brainstem, as well as some of those internal structures of the brainstem. And then we also described the basic function of the internal and external brainstem areas. So when you're studying, refer back to these and make sure you can identify all the external, identify all the internal, as well as describe their function. And with that said, I want to thank you all, and I'll see you all in the next one.